Hello, and welcome back to In Between Sessions, the podcast where we talk about the many ways we can support our mental health between therapy appointments. I'm your host, Lili Torre. I'm a therapist, a podcaster, and a lover of any excuse to talk about mental health. Today, I'm joined by our final guest of the season, Dr. Ashley Clausen. Ashley is a clinical neuropsychologist who specializes in trauma-focused treatments, including therapy for insomnia and nightmares. Ashley has spent over a decade working with first responders and veterans, and she brings such a compassionate, grounded perspective to her work. In our conversation, Ashley and I explore the often complicated relationship between sleep and mental health, why and how sleep gets disrupted, how to start untangling unhelpful sleep patterns, and what's actually realistic when it comes to getting better sleep. If you've ever found yourself lying awake at night worrying about how little sleep you're getting, we've all been there, and this episode is for you. So without further ado, let's get started. Hi, Ashley Clausen.
Hello.
What have you been doing in between sessions?
Oh, so a really big focus that I've had this year is kind of getting back into a regular routine, if you will. So last year I had COVID and it was horrible. And it really took away some of my current coping strategies, which primarily is exercise.
Yes.
So over the last year, I've been kind of rehabbing and trying to get back into it. And I'm very excited to share that this past weekend, I actually jogged for the first time in almost a year.
Oh my gosh. How did that feel?
It was amazing. I mean, very winded.
Sure. Terrible.
But it was amazing to feel like I'm making progress and getting back on track.
That's incredible. And I'm so glad that you shared that and used that example specifically, because I talk to a lot of clients about how pretty much any coping strategy can become somewhat problematic if it's overly used or our only tool in our tool belt. And one of the resistances I get will be oh yeah, well, what about exercise? And I'm like, well, what happens if you get injured? What happens if you get sick and you don't have that coping skill available to you anymore? So that's such a great example of why it's so important to have a diverse skill set.
Yes. And I am kind of ashamed to admit this, but as a mental health provider myself, running and exercise was my primary go-to coping strategy. That and being really snarky. And I find that being snarky isn't always taken.
COVID couldn't take that away.
But so I learned that very quickly myself of having to try to diversify and find other coping strategies for managing just daily stress and for managing sleep.
Yeah. Okay. So sleep, I mean, obviously exercise is amazing for improving sleep. And so I can imagine that your sleep was probably really impacted by not being able to exercise. And I'm curious to hear more from you about, how impaired sleep impacts our mental health.
Absolutely. I love talking about sleep. I love sleep. Definitely not working out, not being in your regular routine impacts your ability to fall asleep quickly, your ability to stay asleep. Your sleep might be less restful, and it makes it harder for us to do our day-to-day stuff when we wake up in the morning, right? We're just feeling more sluggish, more groggy. And sleep is always something I have prioritized, since probably graduate school, of knowing how important sleep is.
Yeah.
So not having good sleep was a struggle, but it was kind of reassuring to me that I'm not alone in that. It's 30% of Americans, adults, will describe having symptoms of insomnia.
Wow.
Which is quite high, right?
Yeah, 1 in every 3 people, basically.
Yes. And that seemed kind of alarming to me because I had prioritized sleep so much that oh man, this sucks. So knowing that other people are struggling with it, and nearly 20% of people will meet criteria for a diagnosis of insomnia, that's just, it seems too high. Yeah. So I love being able to talk about sleep and things that we can do to improve our sleep and how that can improve our overall health and mental well-being.
let's start with defining exactly what insomnia means. I think there's kind of a colloquial use of that term, but what does it actually mean to have insomnia?
Yeah, that's a great question. So oftentimes people will say, oh, I had insomnia last night, right? And
Yeah.
insomnia, the disorder itself, is actually characterized by having multiple nights per week where you're unable to fall asleep, stay asleep, or you're waking up way too early. So say that alarm clock is set at 6, but you're consistently waking up at 4 o'clock and you can't fall back to sleep.
Yeah.
And so we have to be experiencing that at least 3 times a week, and we have to be losing sleep. So say, for example, we're having a hard time falling asleep, but we're able to sleep in. That wouldn't necessarily count. So this would be like, again, that alarm clock going off at 6, but you didn't fall asleep until 3.
Yeah.
So there's probably a tighter criteria than what most people think around insomnia as a disorder. But we can still have dysregulated sleep without meeting criteria for insomnia itself.
Yeah. So I feel like what I'm hearing in that is if you just heard those criteria and you're like, oh, well, then I don't have insomnia, that doesn't mean that sleep isn't necessarily problematic for you.
Right. Exactly. So for example, I work often with first responders. Their sleep is wretched.
Ooh, I can only imagine.
Yeah. So they have a really hard time setting a regular sleep schedule. Their sleep is frequently impacted by, having calls in the middle of the night,
Right.
by sleeping in a room with other people, not having a good temperature in the room that you're sleeping in, like all of these, environmental factors that we might take for granted in our own home where we have control over those things. And so they, this group of people, first responders, they develop different strategies to help them manage that. And they create their own sleep routines, which is fantastic. But then we also strongly recommend safety naps. So if you do have a night where as a first responder, you're up responding to multiple calls, or you've had a really long, difficult call and it's hard for you to fall back to sleep, that following day that you're able to kind of recoup and take a brief nap just to feel more alert and refreshed the next day.
Yeah, I feel like people have really mixed feelings about naps. Like there are people who love a nap, and then there are people like me who can't really nap, or if I do, I often wake up feeling worse. Do you have any insight on how to set yourself up for success with a nap?
Yes. So the first thing I would say is if you're really struggling with insomnia, the disorder, try to avoid naps actually, because that helps us kind of reset our brain's clock. So we know at night we should be sleeping, or whatever your 24-hour clock is, and that during the day we should try to be awake. Now, for healthy sleepers who maybe just enjoy that Saturday nap, we definitely want to try to keep our naps short because of the different stages of sleep that we experience. So when we fall asleep, we fall into stage 1 sleep, which is very light sleep, easily disrupted. Stage 2, a little bit deeper sleep. Sometimes people will describe that feeling of falling during stage 2.
Yeah.
Stage 3 is a deep sleep where we have a lot of recovery that's happening in our brain and our immune functioning. And then we also have REM sleep, and this is where we dream. People don't always remember those dreams, but this is where that occurs. And so they go in a cycle. So stage 1, 2, 3, and then REM, and then we cycle back up throughout the evening. So when we're napping, if we fall into stages 3 or REM sleep, then we often feel groggier when we wake up. So trying to keep our naps shorter to about 20 to 30 minutes can actually help us feel more alert and more awake after a nap. Some of us don't always set an alarm, and so we may not have that luxury of knowing how long we've been asleep. But I would actually recommend, if you start to feel your eyelids getting heavy, to try to set an alarm. So that way, when you wake up, you do feel refreshed.
That's a great tip, because the few times I have tried to nap and I set that 20-minute alarm or whatever, I'm like, oh, but what if I don't fall asleep right now, then it's not really 20 minutes. So should I set it for 30 minutes? But what if I fall asleep right away? Or when is it too long? And that can be really tricky. So I like the idea of kind of that goalpost of okay, when your eyelids start getting heavy, go ahead and set that 20-minute timer. I'm trying to remember the name of the book. I've shouted this out on this podcast before as my toxic trait. Like, I read about interesting things and then I can never remember where I read it.
Been there.
Yeah, it's the worst feeling because I feel like I'm plagiarizing, but I'm trying to shout out that I got it from someone else. I just don't know who. I read in some book the idea of a nappuccino. Have you ever heard of this?
No, but I'm loving it.
I've always thought it was so brilliant, and it's the one thing that like made me want to be more of a napper. He says to like drink a shot of espresso and then immediately fall asleep for a nap. And then when you wake up in about 20 minutes, you will get the rest from the nap and the hit of the caffeine at the same time. And you'll feel amazing.
I bet you will.
And it also has a great name, which makes anything better. Hi, listeners. I couldn't stand the idea of yet again not citing my source here, so I went ahead and looked up the term nappuccino and reminded myself that I got this term from Daniel Pink's book, When: The Scientific Secrets of Perfect Timing. Now, back to the episode. But I am curious to hear your thoughts about caffeine's relationship to our sleep.
Yes. This is probably the biggest pushback that I get from patients when we're working on sleep is caffeine. So caffeine's wonderful. It helps us feel alert and awake and refreshed. And if it's in coffee form, it tastes so good. But it does impact our ability to actually fall asleep and to fall into those deeper levels of sleep, depending on the amount that we have. So the typical recommendation is to actually stop drinking any sort of caffeine about 8 hours before you're wanting to go to bed. Which, when people hear that, they're like, oh my heavens, no, it's not happening. But it definitely impacts our system and our ability to fall asleep and stay asleep. I mean, it makes us wired, right? That's the whole point of caffeine. And so it definitely can impact our ability to get into that good sleep cycle that we need to have. I have kind of a funny anecdote about caffeine and sleep, if that's okay.
Of course.
I was working through an insomnia treatment. It's called cognitive behavioral therapy for insomnia with one of my patients. And one of the recommendations that we have is that if you can't fall asleep or you can't return to sleep within about 20 minutes, to get out of bed. And the reason for this is our brains learn very fast and we start to associate being awake with being in bed. So every time we go to lay down, our brain says, it's time to wake up. And so it's really hard for us to break that cycle. And the best way to do it is to physically get out of bed when we're awake. This is really hard for a lot of people. We're cozy and comfortable in bed, or we think, oh, I'm just going to give it 5 more minutes and I'll fall asleep, right? It doesn't work. So getting out of bed can be hard because we're cozy, we're comfortable, or we're just wanting that anxiety is pushing us to get better sleep. But I had a patient who was doing this beautifully. They were getting out of bed. They, described to me that they were doing things to relax themselves in order to fall back to sleep. And their sleep was not getting better. So we decided to kind of take a pause and refresh. And I said, well, what are you doing when you get up in the middle of the night? And this person said, I'm drinking a Red Bull.
Why?
It was just their drink of choice, I guess.
Oh, no.
All right. So we missed the first session where we talked about caffeine being bad. But we had just spent weeks working on this and like, this should be working. What's happening?
Right.
Find out that we're drinking Red Bull at 2 a.m.
Good thing you asked that question.
Yep.
Wow. Yeah.
That is a huge reminder for me to be checking in with patients on like, okay, when you're up and you're out of bed, what are we doing?
Yeah.
We always want to be doing something that promotes sleep. So listening to those mindfulness exercises, doing some slow breathing. If you're the kind of person that has a hard time sitting still when you're awake, adult coloring can be wonderful. Refolding your socks can also be good because it's boring, right? You don't really want to be doing those things. So those are the types of things that we would recommend when we're up in the middle of the night trying to go back to sleep.
I'm curious about kind of like the opposite, like people who have to get up for some reason in the middle of the night. Like I'm thinking about parents with small children or, selfishly myself, occasionally my dog will wake me up in the middle of the night and like need to go outside or something. And I'm definitely one of those people where like when I'm awake, especially if I've gotten out of bed and I get back into bed, I have a horrible time falling back asleep. What would you recommend for that experience?
That's a wonderful question. For people who are having a hard time getting back to sleep, again, that 20-minute rule, if it's been about 15, 20 minutes and you can't get to sleep, get out of bed. The other thing that I would strongly recommend, oftentimes what happens is our brain just starts going, right? We start thinking about our to-do list or what we didn't finish yesterday, that conversation we had 12 years ago that did not go as planned.
Middle school.
Yes. So having a notepad next to your bed can actually be really helpful to start jotting some of those thoughts down on paper. This doesn't work like a magic wand. It's not super fast, but it gives your brain permission to let it go because it's written down physically somewhere. And so we always then recommend the following day having, 15, 20 minutes where you can review that list. Maybe it's with your morning cup of coffee or breakfast. Maybe it's during your morning break from work to be able to go through those to-dos. Again, it's giving your brain that permission. I know I will get to it later. Yeah. So it's okay to let it go. This is a skill. So like any skill, it takes a lot of practice and it takes time for it to build and to be helpful. Sometimes we just have those one-off nights, and those nights are stinky. It's really hard to fall asleep, and then we're feeling really sluggish the next day if you're not in public safety of some kind. And then I would strongly recommend not taking a nap the next day to push yourself to be able to fall asleep that evening. So we think of we describe what we call a drive for sleep or sleep drive. And I always like to think of it as a gas tank that we are using up throughout the day. So at the end of the day, our gas tank is empty and we're ready to go to sleep. If we take that midday nap or afternoon nap, we're filling that gas tank up just a little bit more. And so it's harder for us to deplete that gas tank in order to go to sleep later.
Yeah. And same with, I would imagine a cup of coffee is also filling up that gas tank.
Absolutely. Yes. I think it's really hard for parents with young itty bitties at home because you have months, maybe up to a year of a kiddo not getting into a good sleep cycle. For those parents, I actually always recommend working closely with your pediatrician to make sure that you're doing what you need for the development of your kiddo, making sure that you are helping them establish a good sleep cycle. And then if you're in the position to have a partner's help to be able to say, tonight's my night, I'm going to sleep, you're on baby duty. So that way you're splitting the load. Not everyone is fortunate enough to be in that position where they have someone who can help them at night. But in that circumstance, a nap is probably very appropriate because your need for sleep is so high that a 20-minute nap is not going to impact your ability to crash at the end of the day.
Yeah, probably not. Yeah, those are all such great tips. I'm curious, I feel like I've heard the term sleep hygiene kind of floating around a lot. And my understanding of it is essentially a lot of what you've described, but are there other aspects of sleep hygiene that you think are important to consider?
Yes. So I mentioned earlier, I like to exercise, right? And exercise is great for the body. It's great to help you get in a good routine and use up your gas tank. But we strongly recommend that you do that earlier in the day versus right before you go to bed. So oftentimes people will, get off work and then they go work out and then they're ready for bed. We would recommend not doing that. So creating a buffer zone between when you're done with your day and actually going to sleep. That includes exercise, that includes bright lights, that includes heavy meals. So trying to get your body prepared to sleep. So if we're eating heavy meals, for example, right before we go to bed, we might initially feel tired, especially if we eat things like turkey that have tryptophan in them. We always talk about the turkey coma, right? But having larger meals, your system is actually working quite hard to digest all of that food. And so your body itself is not actually resting and regenerating the way that it needs to overnight.
I appreciate that you're kind of differentiating or being specific about like a heavy meal. I work with a lot of clients with a disordered relationship with food, and there's a lot of kind of like diet and wellness culture messaging about like, you can't eat X number of hours before bed. And certainly there are some foods that might make people more likely to have acid reflux if they eat them before, like too close to bed, or having a large meal might, like have your body working a little bit too hard to really be able to rest. But that doesn't mean you can't eat anything before bed, especially I would imagine if you're waking up hungry in the middle of the night. That is going to impact your sleep, or God forbid, going to bed hungry, that's going to impact your sleep. And so if you have the ability to keep that from happening, you have access to food that you can eat before bed that ideally isn't super acidic and maybe going to trigger acid reflux. And, again, not a Thanksgiving meal that's going to keep your body kind of awake and energized, then that can also be good sleep hygiene to like eat a little bit before bed.
I love that you're bringing this up 100%. So everything is about balance, right? So we don't want to eat too much. We don't want to eat too little either. We want our stomach to feel content, because if we go to bed hungry, then we're going to be thinking about our stomach, and we're going to be thinking about, why didn't I eat something? Maybe I should get up to eat something. Is this going to happen all night? Right. And those thoughts just start racing. Or if we're waking up hungry, it also means that our body needs to refuel pretty quickly. So having something like a handful of almonds or a cheese stick, if you're hungrier than that, then probably need to push back the time in which we're eating, so that way we're getting a good full meal. Mm-hmm. And then if you're still hungry, having a small snack before bed. The beautiful thing about food, there are so many
beautiful things about food.
But our body's metabolism actually works a lot better if we keep it fueled. Right? So if we continue to eat small amounts of food throughout the day, our metabolism actually is higher. It works better. It's more efficient. So definitely not wanting to restrict our food before we go to bed, but we also don't want to overdo it either.
Yeah, which can feel like a really tricky balance. Like, how much is too much? What foods are the right food? And so I imagine also just kind of adopting this lens of, curiosity and self-compassion that like, sometimes you're going to eat a little too much, and you might be like, oh, that was probably a little too much food, or that was too spicy and now I have acid reflux. And, that these things happen. And like you said, even if you do everything right, not every night of sleep is necessarily going to be a great night of sleep.
It's so true. So true. So with sleep hygiene, right, we look at all the things that are in our control, things that we can modify, the temperature of our room, how dark our room is. Do we have a comfortable, safe place to sleep? All of those things typically are in our control. There might be some extenuating circumstances when they're not, but there are also always things that are out of our control that can impact our sleep, like our level of stress, which is why having those coping strategies is so important. Yeah. You might have had a major life event. Maybe you have a family member in the hospital and you are with them at the hospital and you can't sleep, right? Maybe you have a little one who is crying their eyeballs out because they want attention at 1 a.m, right?
Yeah.
So there are so many things that are outside of our control. So with sleep hygiene, really the strong recommendation is that they're guidelines. We want people to try them. If they work for you, excellent. If they don't work for you, then let's move on to the next item that's on the list. Because for some people, maybe we have to eat before we go to bed. Maybe that's the only time we have to exercise. So are there different shifts or ways that we can tailor sleep hygiene to fit each person's individual needs? So yes, there's this huge long list of sleep hygiene tips, but we like to think of like applying them flexibly as opposed to this like very rigid behavior. So like that 20-minute rule that we talked about. So the idea, again, if you feel like you've been awake for 15 to 20 minutes, get out of bed. How do I know if it's been 15 or 20 minutes? We don't want people to be watching the clock, because then we start thinking about how much time we have left to sleep.
Yeah.
So it's really about being flexible. If it feels like it's been about 15 to 20 minutes, if you start to feel annoyed or frustrated, or that anxiety cycle starts spinning, get out of bed. It might have only been 7 minutes, and that's okay. We want to make sure that we are taking care of ourselves and giving ourselves a little bit of grace when we're trying to improve our sleep.
Yeah, I love the idea of almost using like an internal clock of it's not necessarily about the number of minutes, but it's about the felt experience. Like, am I experiencing sort of the signs that Ashley was talking about that tend to happen after about 20 minutes? Whether, yeah, like you said, that's 7 minutes or 27 minutes, it doesn't really matter. And something with it, I think when you were talking about, we don't want people watching the clock, it made me think about another thing that's talked about a lot with sleep is our phones. And I'm going to give this disclaimer that I really tried to bring a very balanced perspective on our devices, whether it be our use of social media. I did a whole episode about social media and like if there are ways it can be a positive influence on our mental health. But I also really do recognize that there is a lot of science out there that is telling us that there are ways in which our phones are harming us. And so I'm not out here trying to be like, no, cell phones are good. But I also believe strongly that most things are not, black and white, good or bad. And so I'm curious sort of your perspective on how we can use our phones effectively to support our sleep and how we can be mindful with our phone use in a way that supports our sleep.
Yeah, I love that question. I feel like there's probably a lot of layers to this, but I'm going to start with kind of the low-hanging fruit, if that's okay.
Of course.
So our phones can be kind of addictive at times, right? We want to know what's going on in the world. We want to make sure we haven't missed anything. And that in and of itself can create elevated levels of anxiety, which can make it hard for us to put the phone down. It can make it hard for us to step away from it. I've asked patients to leave their phone in another room overnight, and oh my.
People don't like that.
People don't like that. But it can also be used to our advantage, right? So the thing with our phones, the thing that makes it hard for sleep is that it gets our brain going. It gets us more alert. We're more wired. We're ready to be awake because we want to know what's going on. Yes, there's an issue with blue lights, but almost all phones now have like a dark mode or a blue light filter. And so that's less of a concern from a sleep perspective. It's really more about being alert and awake.
Yeah, stimulus.
Yes, exactly. But phones can also be really crazy helpful because there are so many good like mindfulness exercises, or like doing drawing on your phone can be really relaxing for some people. So there are times where we can use it. A lot of phones also have apps for like white noise or, things like that are really helpful to have easy access to, especially if we're traveling. We don't want to take 100 things with us when we're traveling. So there is a time and a place to have phones and to allow phones to help us with treatment. I keep looking at my phone.
It hears you talking about it. You're like addressing it.
I still love you. But we have to be mindful about it because it definitely can impact our ability to fall asleep. So one thing that I used to do, like I would get into bed and I would grab my phone and I just start scrolling because this is my downtime, right? I've got 15, 20 minutes before I go to sleep. I can catch up on the news or on Facebook, Instagram, whatever. I'm one of those old school people. I don't know what Twitter does or is or whatever.
I don't even think it's called that anymore.
See? But that definitely makes it harder to go to sleep. So kind of thinking of it as an experiment with yourself of what happens if I put my phone down and give myself a half an hour before I go to bed or 45 minutes before I go to bed to just let my brain relax. Maybe you read a book, maybe you get into your nighttime routine. Stretching can be a really great thing to do before bed, and that can take up 10, 15 minutes of your time right there. So trying to give your brain cues that it's turning off for the night, right? It's not really turning off, but we're going to sleep, and putting your phone down can be one of them. Something that I do, because I have first responders in my family, is I have like only their numbers that can go through when my phone's on silent. So that kind of gives me that reassured feeling that I'm not going to miss something important.
Yeah.
Because their numbers, and like my mom, her number will ring through. And my whole family also knows what time I go to bed, which is just kind of helpful.
Yes.
So I think that there are ways that we can be creative with our technology to ease that anxiety or that stimulus without completely detaching from it.
Yeah, I mean, I think that sounds like a combination of sort of setting expectations, like communicating to your loved ones, like just so you know, I go to bed at like 9:30. So like I don't want to hear from anybody after 9:30 unless it's an emergency. Using some of our phone's features like do not disturb and like the specific like settings. Like I have a sleep do not disturb that automatically goes on at a certain time and automatically comes off at a certain time. And certain people can break through it if they need to. And then, yeah, being mindful with, again, you've mentioned routine a few times, what your nighttime routine looks like. And, you know, for me, this was something that I was working on. I got into the habit of falling asleep to a show playing on my phone on Netflix. And I just didn't want to keep doing that because also if I would wake up in the middle of the night, continuing to hear that would make it harder for me to fall asleep, which is weird. It helps me fall asleep in the first place, and then it kept me awake later. Don't understand it, but that was the reality. And so I was like, I'm going to start reading before bed. And I really got into the habit. And then this took me an embarrassing number of weeks really to notice. But I was reading and then I would put the book down and then I would pick up my phone and scroll. And I was like, wait, the whole point of reading was to stop scrolling on my phone. So I do use my phone as my alarm clock. So I plug it in at the other side of my bedroom so that it's not right by my bed, but it is still in the room so that I can hear it go off. And then I have to get up to turn it off, which for me, everyone listening to this can hate me. I am one of those people that like when my alarm goes off, like I'm awake, bright-eyed, bushy-tailed, like ready to go. My husband hates me for that. So it's not hard for me to get out of bed, but if it were, having my phone across the room would make it much easier for me to get up and get out of bed because I have to go turn it off.
Yes, that's actually one of the tricks that we use in CBTI is to actually have them just move an alarm across the side of the room. So that way you have to get up to turn it off. So it is helpful for sure to have those tiny tricks up your sleeve that you can use. I am also jealous that you are bright-eyed and bushy-tailed when you get up. I am definitely not that person, but I'm also not the snoozer. Like I will not hit snooze 14 times either. I think my partner would become homicidal, but
yeah. What would you say to someone who might be listening to this who is a snoozer?
I would want to know why we're snoozing. That would be my first question. What is it about the morning routine? Is it, that we're not wanting to get up? Is it that we can't get up? Is it we just want 5 more minutes of sleep in our comfy bed? And I think trying to figure out the motivation behind that behavior can be really helpful. We have this phrase that we use through behavioral activation that's called function versus form. So the form of the behavior might look the same for everybody, like hitting snooze, but that function of hitting snooze could be very different. So for some patients who have like underlying medical conditions that just make it really tough to get up in the morning, they might need multiple alarms because they might hear that first one, turn it off, and then I will get up, I'm going to get up, and then all of a sudden they're asleep again. So having, multiple alarms can be really helpful. It's not technically the same as snoozing, but it looks the same, right? The form of the behavior looks the same versus other people who are just, I do not want to go to work today, so I'm just going to keep hitting snooze. Yeah. Then that results in us trying to rush through the morning because even if we don't want to go to work, most of us still have to go to work. Most of us have a certain time that we have to be at work. So it really just makes our morning that much more difficult and challenging. So I would definitely want to know what the motivation is behind the snoozing.
Yeah, that reminds me so much of how I talk to a lot of my clients about self-care, that what constitutes self-care is going to look different each day and honestly, like each moment. So like one day where you got a terrible night's sleep and you don't have an early morning meeting, hitting the snooze button might actually be the act of self-care because you need a little bit more sleep. It's okay if you're a few minutes late to work, like that's fine. Mm-hmm. On another day, regardless of how your sleep went, if you have a 9 a.m. like really important presentation, hitting snooze is not going to be an act of self-care because you're going to be really stressed and rushed and nervous about making it in time. And like that's ultimately going to do more harm than good. So really kind of thinking to yourself, like, what is self-care right now? And it's exactly as you described. Like if someone were watching on a video camera, it looks like the same behavior, but the internal experience and sort of like that why behind it, I guess, is different.
Yes. And I love bringing up self-care. Oftentimes, sleep is the first thing to go because we have such busy schedules and we're trying to fit so much in to, our 12-hour day when we're awake or however long most people are awake. And so sleep just becomes a notch down, right, on our priority list. And if we continue to do that, if we deprioritize our sleep, it's going to impact our health. It's going to impact our cognition. But importantly, with health, we're more susceptible to getting colds or catching flus, right? If we're not getting good sleep. And then that ultimately results in us needing more sleep because we're sick and we're trying to heal. So trying to make that argument to people of, well, I just don't have time to sleep. Let's think this through. Let's think about giving yourself permission to get 7 to 9 hours of sleep.
Yeah, you honestly don't have time not to sleep because eventually your body will win. Your body will make you sleep.
Exactly. Yep.
What are some of the impacts? You just spoke a little bit about like physical health, but what are some of the impacts on people's mental health, especially with like chronically impaired sleep?
Yes, that's an excellent question. We definitely see a cyclic effect with sleep. So if we're getting good sleep, we feel better, right? Our mood is usually a little bit brighter. We have better control over our emotional responses. And that is honestly because our brain is getting good sleep as well. It's restoring the parts of the brain that help us regulate emotion, that help us regulate cognition, are getting repaired overnight, and they get to fill up their gas tank overnight. Yeah. So when we're not getting good sleep, especially chronically, that can lead to developing symptoms similar to depression, anxiety. Some people do just meet those full-blown disorders as a result of not getting good sleep. And that feeds in to how well we're sleeping. So if we're feeling really anxious and on edge, it's going to be a lot harder for us to fall asleep. Sometimes we see decreased sleep in patients with depression, but we often see hypersomnia. So where people are sleeping a lot. And that makes it really hard for us to feel awake and alert during the day. And we just consistently feel like we need to get good sleep, or any sleep. It doesn't have to be good, just any sleep. So what we do see, even with like PTSD, post-traumatic stress disorder, sleep is significantly impaired in individuals who have PTSD, is that fixing sleep, honing in on getting good, structured, restorative sleep can actually help improve other symptoms of mental health. Again, not a magic wand. So for like patients who do have meet criteria for a diagnosis of depression or panic disorder, PTSD, those symptoms aren't necessarily all going to go away just because we're sleeping better, but it helps us better manage or control those symptoms.
Yes. Sleep is so foundational that without it, it's like anything else that you're trying to do to address whatever it is you're experiencing isn't going to be nearly as effective because we just don't do as well in general without sleep.
It's so true. It's so true. It sounds so easy, right? Just get better sleep. Just sleep more. It'll be fine. But we know that it's not that easy for people to just get better sleep. So oftentimes working with a clinician going through cognitive behavioral therapy for insomnia can be really impactful. That particular treatment really helps us restructure our sleep and focus on those more environmental factors like our sleep hygiene. But if that doesn't work by itself, then we always recommend talking with your medical team about different supplements that may be helpful to promote sleep, like magnesium or melatonin. Those are supplements that we can get over the counter. They can be relatively cheap, but they're also already occurring in our body, right? So we already make our own melatonin. We have magnesium within ourselves already. So we're not adding an additional product or medication into the system that might make sleep less restorative. That's really what we see with things like Ambien, is that it's disrupting more of our restorative sleep. So you might be sleeping longer, but you're not necessarily feeling refreshed. If you want some crazy dreams, go for it. But
it can be fun every now and again.
Yeah.
So I feel like you were just kind of starting to address this. And I always kind of like to, towards the end of an episode, get some like clear takeaways for listeners. But because sleep is so individual, I'm curious what your recommendation would be for someone who maybe does meet the criteria for clinical insomnia, someone who just has like deeply impaired sleep but doesn't quite meet that criteria, versus someone who like sleeps well for the most part but knows that they could probably improve their sleep. Like, what would you tell each of those people?
Yes. So I'm going to start in the reverse order. So for people who may just want to be working on their sleep, and they may not necessarily have a significant disorder or impediment to falling asleep, but they just want it to be a little bit better, I would definitely say look at your sleep environment. And that means going back to sleep hygiene. So let's review what I think I'm doing well and make sure that it actually is promoting good sleep. A really great example of that is oftentimes people will shower at night to help them relax or to just kind of wash off the day, right? But if we take a hot shower, that actually can impact our ability to fall asleep. Our body temperature drops a few degrees before we're able to actually fall asleep. So if we're hot from a hot shower, it's going to just take a little bit longer to do. Yeah. So removing those types of things, I think, can be really impactful for someone who's just trying to work on improving overall sleep. For people who have more moderate sleep dysregulation, but they may not quite meet criteria for insomnia, I would say making sure that we have a good routine in place. And that routine is set in stone for you weekdays and weekends.
Yeah, that's big.
Yes. And it doesn't have to be forever. Like, this is just while you're working on sleep, making sure that we're going to bed around the same time, that we're waking up around the same time. We generally give about a 30-minute window for each of those things. We can't always control when we fall asleep, but we can control when we're getting into bed. And then that 20-minute rule that I discussed before, I think those are the most impactful ways to improve sleep. If we're struggling beyond that, if we are having a hard time falling asleep, staying asleep, waking up super early, more than 3 times a week, then we definitely want to start seeking out additional support or treatment. The reason for that, the most effective way to improve our sleep is something called sleep restriction, which sounds horrible, right?
Sure does.
I'm not sleeping and you want me to restrict my sleep even more. But this is something that we would really want you to do with a mental health provider who is well trained in cognitive behavioral therapy for insomnia, because we have this psychological effect that we are sleeping less for the first week or so that we're doing this sleep restriction. Most people aren't sleeping less. They're sleeping about the same as they were before, but it just feels worse. You know that you're working on it, you're out of bed, you're limiting how much time you're actually spending in bed, and that psychologically it's kind of tough on us. So making sure that we have that added support. The other reason for added support is what we were discussing before, is where if we have chronically bad sleep, that can impact other aspects of our mental health and of our physical health. And so making sure that we're working with a provider to get more like wraparound care, because it may not just be sleep that we need to work on. Maybe there are other aspects of anxiety or of depression that we need to make sure we're really working into treatment. That doesn't mean that you won't gain skills to be able to do this on your own. So one thing I love about cognitive behavioral therapy for insomnia, we're teaching you to be your own sleep therapist.
Yeah.
Because sleep will ebb and flow over time. We might have a couple of years that we're sleeping great, and then some life event happens and all of a sudden we're all over the place again. So if you can go back to, those worksheets or the notes that you took while you were working with your provider, you can become your own sleep therapist and know this is what worked well for me last time. Let's start here and try this again. So the goal is not for people to be in therapy forever, to be reliant on a therapist for sleep, which is a big differentiation from medication, right? So meds, we're relying on the med to help us fall asleep.
Yeah.
Versus therapy skills that we're building and refining and honing our own abilities.
Yeah. And what that's bringing up for me is, regardless of where you are on that spectrum that we just kind of outlined into like 3 categories, if you are in therapy for whatever reason, I think sometimes, and I'm certainly guilty of this, I always ask clients about sleep in the first session, second session, whatever. It's always part of the intake for me, and we talk about sleep. And then we probably don't really talk about it again unless it's become a really big issue. Or I have a client who just had a baby. We're definitely talking about sleep because she's very tired. But if you are seeing a therapist and you've been seeing a therapist for a while, bring sleep up to them. Talk about it. It's a huge piece of your mental health. And if your sleep is so impaired that you maybe do meet the criteria for insomnia, they can also refer you to someone who specializes in that to make sure that you're getting that support.
Yes, absolutely. So as a trauma-focused therapist, I almost always ask about sleep when we're doing sessions together, because the work that we do can trigger some difficult thoughts or memories that can make it hard for us to fall asleep or stay asleep. So there are often times that I will take pieces of cognitive behavioral therapy for insomnia and mix it with some of the trauma-focused work that I'm doing. There are also treatments. One thing we didn't really talk a lot about was nightmares. And so we have behavioral interventions as well for people who experience nightmares often. So I would say, just like you said, ask, talk, bring it up. The worst thing that can happen in these situations, I feel like, is your provider says, I don't really know a lot about this. Let's get you connected to someone who does.
Correct.
I don't know any mental health provider that would be like, you're on your own. Good luck with that.
You can't talk about that in here.
Exactly. But sleep, definitely mental health, as much as it is physical health.
Definitely. Ashley, thank you so much. This has been so helpful. And I'm curious to know what you're going to do before your next session.
Well, I feel like I have a lot on my to-do list. But one of the things that I'm most excited about is I'm going to be working with Johnson County EMS services, and we're going to be talking about mental health with first responders.
Awesome.
So I love these types of opportunities to engage with first responders and just the community at large. And being able, we'll be talking about sleep, and we'll be talking about just mental health symptoms that can pop up for first responders, given the types of work that they do.
Yeah.
And I think that this is one of the most rewarding parts of my job, getting to give back to people in our community who give so much for us.
And who definitely have impaired sleep. I can't even imagine.
Exactly.
Well, thank you so much. I so enjoyed talking to you, and I appreciate all of your insights.
Thank you, Lili. I enjoyed being here.
I hope this conversation with Dr. Ashley Clausen gave you a fresh perspective on sleep, and maybe even some gentle permission to release a little of the pressure around it. If you'd like to learn more from Ashley or work with her directly, you can find her at Heartland Neuropsychology and Mental Wellness, where she currently has openings on Fridays for adult individual therapy. She offers trauma-focused treatments for insomnia and nightmares, as well as support for anxiety and depression, all rooted in evidence-based care. And if this episode sparked something for you, I would love for you to share it with a friend or leave us a review on Apple Podcasts so that more people can find In Between Sessions. While Ashley was the final guest of the season, I will be releasing one final episode, including my reflections and takeaways from season 1. And I'll be asking for your feedback to guide me as I work on creating season 2, so be sure to check it out. As always, thank you so much for listening, and I'll see you next time in Between Sessions.